Welcome to the webinar, Online Content with DocCom Modules. I'm Barbara Lewis. This webinar will last about 30 minutes and the recording will be available on the website. If you have any questions, please type them in the Q&A box, and if we don't have a chance to get to your question during the webinar, we'll respond afterwards. But before we hear about how the modules are actually being used, let me tell you a little bit about DocCom. DocCom is a proven online interactive communication skills learning system. And a little bit about the background. Next slide, please. That's okay. DocCom was founded in 2003 by the Academy of Communication in Healthcare and Drexel University College of Medicine. Next slide. And we obtained a grant from the Arthur Vining Davis Foundation. It was launched as a pilot in 2005 and debuted as a nonprofit. We have been offering continuing medical education since 2015. We have about 75 institutions that are subscribed to DocCom, including medical schools, residency programs, and hospitals. And we have 9 research articles that have proved the value of DocCom, which you can check out on our website if you want. On the overview slide, number 6, we'll just mention here that our module authors are leading faculty. We have 42 multimedia-rich interactive online modules and over 400 videos that are unscripted. We have quite a few interactive annotated videos as well. And the whole back end has a lot of information for faculty, including giving assignments to your learners, sending assessment questions. There's a grading matrix, lots of resources, and a curriculum guide for faculty as well. So we are very fortunate today to have 2 professors who have been using DocCom in their curriculum at the Alabama College of Osteopathic Medicine. Dr. Rhonda Carter is Assistant Professor of Family Medicine and Co-Course Director of Primary Clinical Skills. And Dr. Lauren Clemens is also Assistant Professor of Family Medicine and Osteopathic Principles and Practice and is the Co-Course Director of Primary Clinical Skills. And now I'm going to turn it over to the 2 of you. Thank you so much for being here and sharing this information with us.
Sure, thank you, Barbara. Our objectives for today are to understand how DocCom modules can enhance a clinically focused curriculum, to know how to incorporate DocComs into the online curriculum delivery, and to understand how to incorporate DocComs in both the preclinical and clinical years. The institution that we are at, Alabama College of Osteopathic Medicine, has been using DocCom in the preclinical years since our school began in 2013. We found that when we had to go virtual last spring with COVID-19, DocCom was also a useful resource for our clinical curriculum. Dr. Carter will first describe how we traditionally use the modules in the preclinical years and how this can easily be modified for virtual delivery. And then I will describe how we've used the modules in our clinical clerkships.
All right, thanks, Dr. Clements. So what we do is in our preclinical curriculum, we always start the students out with what we call a designated student assignment. So that's an individual assignment that the students complete ahead of time before we do some sort of interactive activity that they'll do in a group and with faculty. Traditionally, we've done those on campus, either in our team-based learning center or in our small group rooms. But as Dr. Clements said, what we found is that those easily can be modified to fit with one of the online platforms. We use Zoom, but I know other schools use Microsoft Teams or other platforms. So that's what we're doing this year, is just modifying the activities we've always done and delivering them virtually. There are wonderful assignments that are already built into DocCom that you can use if you want to actually grade the assignment. And that's what we do. So usually we'll have the students complete a DocCom module and answer one or more of the discussion questions that are provided and submit that to us in writing before coming to the group event, and that demonstrates for us that they've already done the assignment and that they're prepared to participate. And then we follow by either what we call a small group event or a team-based learning event. And the key distinction there, as you may already know, is that small group events, we actually have a faculty facilitator sitting in with each group of students to help with the discussion on the topic, versus a team-based learning event. We may have just one or maybe two faculty facilitators for the entire class. And so the student groups actually just talk amongst themselves without an individual faculty member in each group. So our course, the primary clinical skills course, we actually like to have a faculty facilitator in each group. But our Foundations of Modern Healthcare course, they actually run theirs as team-based learning. And either one is an effective way, and it just depends on what your goal is, what the topic is, and sometimes just how many faculty you have available on the day that you want to run the event. Next slide, please, Dr. Clements. What we thought would be a good way to introduce you to how to do this is actually to just run through one of our actual examples that we use. And so DocCom Module 6 is called Build the Relationship. And this is one that we like to use very early on with our first year students when we begin teaching interview skills. So when we're getting ready to teach interviewing and taking the history of present illness, before we like to let them launch into, well, when did it start and where does it radiate and how long has it been going on? We want them to go ahead and start by just talking about basic listening skills and respect skills and just how do you actually interact with that patient so the patient feels listened to and heard. And this is a great module for helping students process the idea of that skill. And so the way that we word our instructions are just what's right here in this slide. We say read DocCom Module 6, relationship, complete discussion question number 1. We actually, for the first years, because their other assignments are in ExamSoft, which is the system that we use for graded assignments, we have them go ahead and just submit it there. But you can do graded assignments right there in DocCom, and Dr. Clements will go over that later because in later years we use the actual DocCom embedded system. And then we ask them for this module to actually just read the additional discussion questions so that they can discuss them in their small group. Next slide. And this is what the module, part of the module actually looks like. So in the module, there are 5 key skills that are focused on attentiveness and warmth, empathy, respect, support, and partnership. And for each of those 5, there's a nice description of what that means, what's important, what the skill actually is, like how do you actually show respect to a patient. Then, just as Ms. Lewis mentioned, there are videos. So the student will actually click right there on the video and they can watch a doctor-patient interaction where the doctor shows respect for the patient. There's actual samples, that's the blue box there where it says clinician, actual ways to word it. I'm impressed by how well you're coping, or you're doing a great job of managing your diabetes. What's interesting is sometimes, even though the videos are realistic, the students may say, well, that didn't seem realistic to me. That's not the way I would say that. And you think, okay, well, how would you say that? And so it's really a wonderful way to go ahead and get those creative juices flowing in the students' minds before they come to the actual session or before they participate in the Zoom session and actually try to interview their first patient or their first classmate. Next slide, Dr. Clements, thank you. And these are the actual assessment questions. So usually we just use the first one for the written assignment that basically is just 1 to 2 paragraphs. What have you learned from the module? But the second group of questions, there are much more specific and much more reflective essay type questions, like in thinking about your own skills and connecting with friends and others. Which of these could you apply to building relationships with patients? Or which of these skills do you consider most important? It's a really nice thought-provoking questions. Like I said, there's so many ways you can use DocCom. It's like you can have them go ahead and answer all of these, or you can wait and have them answer each of these questions in small groups, or you can have them pair up. There are also a wonderful set of multiple choice questions that Dr. Clements will go over with you and how we use in the clerkships during the clinical years. Next slide. And then the really fun part is when they actually show up either in person before COVID or on Zoom on the day of the small group event. And so what we do is we plan out based on the topic what we're going to do that day. For Build the Relationship, and our groups have somewhere Usually, ideally, we have 6 to 8. Sometimes we have as many as 10 students with the faculty. What's great is on Zoom, you can use breakout rooms. If you have 8, 10 students, you can see everybody on the screen so that you can watch body language. You can tell if somebody's wanting to say something. You can tell if somebody's a little distracted. Make sure you have everybody turn their video on. Do you want to be able to see everybody? You want them to see each other, especially if something like this where you're actually wanting to practice eye contact and attentive listening and watching body language. So make sure that you do that with these type of events. The first thing that we'll do for this session is just ask the students to reflect on a personal experience that they've had either as a patient or having a family member or a friend being a patient, and either having it been a really good experience at the doctor's office or a bad experience. And then think of it in terms of this module. What was it that made it a good or bad experience? Was it that the doctor was a great listener? Or was it that the doctor never made eye contact? They were standing at the door and looking at their computer, and have them actually really apply it to a personal experience that they've had and figure out either what from that experience they want to carry forward in their future interactions, or what about that experience they want to avoid. Then after they've done that, and again, kind of gotten those creative juices, we have them specifically list those 5 skills from the module and concretely define them just to cement them in their brain. And then the even more fun part is we do role playing, and to get them going, because it's sometimes hard, especially with first year students, to say, okay, 2 students step up, you be the doctor, you be the patient, and role play. We go ahead and write out scripts, and we write out what the doctor would say and what the patient would say, and we just have them actually just flat out read it off. So I might be the doctor, and Dr. Clemens might be the student, and I would say, hold my script. Good morning, what brings you in today? Dr. Clemens would say, my ankle really hurts. And I would say, I am so sorry to hear that. Tell me more. And just go back and forth. And then we have to reflect on, well, how did that feel? How were those words? What did you like and not like about it? And then as the group kind of loosens up, we back off on the scripts and let them just start role playing more. And we have some scripts that have only patient role, and let the students, they can do retakes if they want, or they can do improv if they want. Somebody who says, oh, I've got a history of migraines, I'll just be the patient. And we do that, really allow an hour and a half to 2 hours for these sessions. And so they go really great. Next slide, please. This slide just shows all of, actually, I don't think it's all, a lot of the modules that we use during our preclinical curriculum, so during the first and second year. And you can see there's just so many options depending on what you do. And certainly we don't use DocCom as a replacement for our curriculum. What we use it for is to really complement our curriculum. So a good example is the modules on anxiety and panic disorder and communicating with depressed patients. So when they're in their neurobehavioral course and they're getting the lectures that, I won't say they're dry, but they're a little more technical on DSM-5 diagnostic criteria for anxiety and depression. And so they're working really hard to memorize that diagnostic criteria. What we'll do is simultaneously for our course is have them watch those modules of, well, how do you recognize just clinically if somebody's depressed or if they're anxious? What might their body language look like? How do you bring it up with a patient, especially if they don't come in saying, I'm depressed? How do you approach that with the patient? And so we let them work on that, and then we'll have them come in and do one of these sessions. And it's one of our best sessions. The students love. What we actually do is train our SPs to come in and actually say they're just here for a blood pressure medication refill, but then as the encounter unfolds, they're clearly depressed or anxious. But we'll do that in a small group setting so that the student's not completely on the spot. And again, you can do that in Zoom. You just have the SP in a little window, just like one of us is, and you let the students interview. And as the student, as the SP becomes tearful, you go, oh, okay, well, what do you say now that the patient is crying? So like that you can be really creative. Tobacco and alcohol, we've had students actually take a few minutes in breakout groups and work on skits, and then present back to others in their group a role play on a good way to talk to someone about the fact that they need to quit drinking versus a bad way to talk about that. And so, because you can be really creative, and what we found is that sometimes just by working through the modules ourselves and watching the videos, we get good ideas of ways that we can use them. And also just asking the students, sometimes they'll say, oh, next year, can we do X, Y, Z? So lots of ways to be creative with it. And on that note, I'll turn it over to Dr. Clemens to tell you a little bit about third and fourth year.
So we had to convert the clinical curriculum to an online curriculum with short notice in the spring. The DocCom modules became a useful tool for several of our clerkships. There were a total of 8 modules used in 5 clerkships. These were primarily our primary care clerkships, and the modules chosen typically came from the communicating in specific situations and the communicating with colleagues category of DocCom. This is an overview of the modules that were used in the clinical curriculum during our emergency remote curriculum. As you can see, there was 1 module each for pediatrics, internal medicine 1 and 2, and hospice. And then our family medicine clerkship actually was able to use 4 modules, and we'll talk more about that in a little bit. The pediatrics clerkship used module 21, the pediatric interview, and the students were required to complete the module, and then they had several assignments at the end. So they were required to submit an essay about the questions for reflection. This essay assignment was to give their thoughts regarding how their opinions about the reflection questions have changed since they started their clinical experiences. Because this curriculum started mid-year in March, all of the students had previous clinical rotations to compare to. And the students were also asked to complete all of the discussion questions and all of the multiple choice questions within the DocCom module. And they submitted these answers within DocCom. And then completion of the DocCom module was confirmed at the end of the rotation, and their grades were assigned based on how they completed the questions. Here are some of the reflection questions for the pediatric module, and we feel that these questions can be useful to the students, even if this was a module that they had already completed prior to the preclinical curriculum. So I think there's one module that was actually part of both the preclinical and clinical curriculum, but the students have a different motivation for learning in the preclinical and clinical years, as well as different experiences at that point in time. So often a different aspect of the module may have an impact on a student at different stages in their education. This particular pediatric module was also useful in a time when the students were not able to have any patient contact, because there were examples of patient encounters with children of several different ages for them to observe within the DocCom. This slide shows an example of one of the discussion questions and the multiple choice questions for the pediatric module, and the students were asked to complete all of these questions and submit them to receive credit for their clerkship grade. During the internal medicine clerkship rotations, there was 1 assigned DocCom module for each clerkship. These modules were chosen for interactions that the students would typically have on an internal medicine rotation. So for the oral presentation module, students were required to complete the exercises that we'll discuss on the next slide. And for both modules, the students were again required to complete the discussion and multiple choice questions. These clerkships counted the module completion towards the student's preceptor evaluation grade, since the preceptors would typically be evaluating students' oral presentations and team interactions. On the right side of this slide, you can see one of the exercises in the oral presentation module, and the students had to watch a patient interview, and then they had to watch and critique 3 different student presentations of the encounter. And they were able to identify strengths and weaknesses from each of the encounters. The family medicine clerkship required weekly DocCom module completion. And as with other courses, the students were required to complete the questions for reflection and answer the discussion and multiple choice questions in the assessment. However, this clerkship was different because the students were also required to discuss each module in a weekly video conference with the clerkship chair and the other students on the rotation. These video conferences were 1 hour, and they discussed the points that were brought up within the modules. So similar to the preclinical years, these modules were used as a springboard to a discussion held on Zoom. The topics chosen for each of these weekly video conferences were topics that were very important for students and involved topics that many students may not even see if they were in clinic for a whole month, including domestic violence, medically unexplained symptoms and somatization, dialogue about unwanted outcomes, and ending clinician-patient relationships. The hospice clerkship utilized the communication near the end of life module. And this clerkship required the student to complete the module on their own, but did not require them to complete the assessment questions. Instead, it was used as a starting point for one of their weekly video conferences with the clerkship chair and the other students enrolled in that rotation. Are there any questions at this point?
No, we don't have any questions. That was just incredibly informative and instructive. And thank you so much, Dr. Carter and Dr. Clemens, for that great presentation on how to use DocCom modules. This is especially important now for our virtual learning. So if anybody has any questions, go ahead and write them in the box, the Q&A box, and I'll just continue here with the next slide. A little bit about the cost of the group subscriptions. You can go to our website here, and it's very inexpensive to subscribe to DocCom, only $30 in the US, and if you have over 500 in your domain names, your URL domain names, then it's reached 15,000 as a cap, actually. And if you want to go to the next slide, I will open up questions here. So one of the questions is, what feedback have you gotten from the students about using the DocCom modules?
I'll actually go ahead and take that one because I was actually thinking of a comment that I would make if we didn't get any questions, which is initially when we were only using them in the first and second year, there were always at least a handful of students that were a little bit ho-hum about DocCom, and I think it's just because they weren't seeing patients yet. You know, it's preclinical years. You know, some of the things just, I think until you're seeing patients just may not make a lot of, I think they make sense, but you're busy studying anatomy and biochem and those kinds of things. And it never failed that group of students about 3 months into third year. Initially, we didn't have DocCom available for our third and fourth years. We would start getting emails. Can I get my access back to DocCom? I really need that module on how to talk to a patient with X, Y, or Z. And so, you know, now we have access for that. Now, the great majority of students, I think from the very beginning, love the modules. What would you say, Dr. Clemens?
No, I would absolutely agree. And, you know, we always appreciate those stories of students saying that was really useful, even if it comes in a couple of years later.
We do have quite a few testimonials on the website if you want to go to that, from users, faculty, across the board, residents, medical students, etc. We have another question in here, and you mentioned that you have been using DocCom since the school started in 2013. This question is, if we ever get back to normal in-person clerkships, will you continue to use DocCom modules?
Yeah, so obviously this was multiple clerkships and multiple clerkship chairs who developed this curriculum, but in talking to them, many of them have found it very beneficial. And we had the weekly, or sometimes they weren't weekly, but there were video conferences before we went to our COVID curriculum. And so I think some of our clerkship chairs would continue to use these modules as springboards for those video conferences that they do have.
I think Dr. Clemens and I just talked about it this morning, and she brought these points up during her part of the presentation. Is what's interesting is these DocCom modules really have something for everybody, regardless of your level of training. So even for me, like the first time that I did them when I came to ACOM a little over 4 years ago, I'd been on in practice, I don't know, 15, 18 years. And I was like, wow, like I picked something up that I wished I'd had in practice, even as somebody who had, you know, was a fairly seasoned practitioner. So students note that, you know, even if there's a module that they did first year that we have them do again third and fourth year, there's still something to be gleaned by having them repeat the module now that they've been out seeing patients. The other thing that I think was an excellent point that Dr. Clemens made is that, you can't guarantee that on family medicine rotation, and actually you hope not, that a student's going to see domestic violence, or they may not have a patient get angry with them. And having these modules that you can have the students do, you can ensure that they at least get to talk about that topic and watch interviews with patients that are facing that topic. Some of the interviews, especially the ones, say, with substance abuse, actually interview real patients, and some are even physicians that actually have struggled with addiction. And so it's a nice way. And so I would say that we most likely will keep a lot of these modules even once we return to quote unquote normal curriculum.
And we got in a couple more questions too. I found interesting to using the examples from personal life. Did the students find these useful and provide good answers?
Yes, and I'll let Dr. Clemens comment too, but both of us have been doing small groups and PCS, and you find out so much so often. You find the reason that students initially decided to come to med school was because of either good or bad experiences that they or a friend or family member had in the medical system. And so often actually using these modules and these small group discussions to help them stay tied into that while they are having to prepare for boards or struggle with pathology, it's really nice. What do you think, Dr. Clemens?
Absolutely. Always, we like those real life examples.
Yeah, they get really talkative. I was surprised. Like, if you ask them a question about biochem, they're all going to look at the floor. But if you ask them something like that, they'll all just jump in. So it's a really nice way to get them started talking, really.
Have some of the year 3 preceptors taken an interest in the modules?
Absolutely. I think all of our faculty were aware of DocCom because we use it in our preclinical years, but none of them had incorporated it into the clinical curriculum before this happened. And so I think they've seen how resources that we already have can be expanded into the clinical years as well.
Do your students practice communication skills learned on DocCom with SPs?
Absolutely.
And actually what we do is the week I described where we do the build the relationship skills, the next week we actually bring in SPs to the small group for them to then, we actually have the SPs go ahead and memorize a script, and we have the students go ahead and interact. So that we make sure we do 1 week with students just practicing with each other, and then the next week we bring in SPs.
When students answer the discussion questions online, do they see each other's answers?
No, I'll let Barbara clarify this for sure, but I'm pretty sure that all they see is their own response and they submit it online, but it's not like a discussion board. You could certainly put them on a discussion board, but that would be in a different format.
Right, so what we do for our course, we make sure that they know that their responses will only be seen by the course directors. We do oftentimes take the beginning part of a small group to say, would anybody like to share what they wrote in their discussion question? But that way they feel comfortable if there's something they want to explore, but that they wouldn't really want their classmates to know, we don't disclose that. If they choose to share in small group, they're welcome to, but we don't share that without their permission.
And that brings us to the end of the questions. Thank you so much, Dr. Carter and Dr. Clemens. This has been a great presentation.
We're happy to be here. Thank you for inviting us.
And I'd just like to say that if anybody is interested in more information, I can take you on a very brief tour of DocCom and the modules and the back end of how everything works with the assignments, and provide you with a trial subscription, a 30-day free trial subscription. My email address is really easy, bal326@drexel.edu. And thank you everyone for joining us today. The recording and the PowerPoint will be available on our website shortly. Thank you.